just introduce yourself, your background, training for us?
Hi, everybody. My name is Coceka. The surname is Mfundisi. I'm a neurosurgeon based in Johannesburg, currently working for myself in private practice. I went to my educational background. So originally I'm from the eastern part of South Africa, the Eastern Cape, the home of legends, where the Nelson Mandelas and everyone who's famous comes from. Other South Africans are not going to like that. I studied in Mthatha, did my high school there, and moved from there after matriculating, which is grade 12, and went to Cape Town, UCT, where I started off and wandered into the engineering field. Did first year in engineering, didn't like that at all, and then changed to medical school to do medicine, which was my first love and something I had actually wanted to do for a long time. So after completing my first degree at UCT, just for the purposes also for the student, that's a 6-year program. And you obtain what we call an MBCHB in South Africa, Bachelor of Medicine and Bachelor of Surgery. Then went on to do my internship of 2 years at PE Hospital Complex, Port Elizabeth Hospital Complex in the eastern part of South Africa as well. After that, I went on and did my community service back at home in Mthatha in a hospital called Nelson Mandela Academic Hospital. And from there, I then started looking for a post to train as a neurosurgeon. And I then landed a post eventually at the University of Pretoria, which is now in Gauteng, the central part of the country. And that is where I started and completed my training of 5 years, doing my Masters of Medicine in Neurosurgery, and at the same time doing the Fellowship of the College of Neurosurgeons, which is via the College of Medicine of South Africa. So those are it's a dual qualification that one must attain in order to be registered as a neurosurgeon in South Africa. So finishing that, I then worked in Pretoria at the Steve Biko Academic Hospital as a consultant for approximately 2 years. I then left that hospital to go on to the biggest hospital in the continent, Chris Hani Baragwanath Hospital, based in Soweto. It's a 3,000 bed hospital. I then worked there as a junior consultant. Initially, I did a year of base of skull. After that, I did a year of oncology. And then after that, I then did my first love, which is pediatric neurosurgery. Doing that for 2 years until 2019, which is when I then left the public sector. At that time, I was also working, of course, running my private practice. I had run my private practice in Pretoria while I was still working in Pretoria in 2015, 2016. And then I then decided to then set up mostly at Joburg, which is where I am currently working from Busamed, Orthopedic and Oncology Hospital. In Johannesburg. So that's where I work, and I run that practice as well. I'm also, I'm not just a neurosurgeon, I'm also married. I have a lovely, handsome husband that's also a medic. And we've got 3 kids. I have 3 sons. And I did all of this while, first child was while I was training. The other 2 children were when I had qualified. Yes, and I'm supported by a lovely lady who assists us with the kids. Yeah, that is my context in terms of my training and my work. And just for context, for some of you, the South African system is basically made up of a dual health system, a public and a private healthcare system. And some of us would have worked in both systems at some point in our lives. And then at some point in our lives, we then branch out to do full-time private practice and others. And later on in life, sometimes we return to the public health service. So that is, yeah, that's who I am.
Thank you so much. Would anyone would like to ask some questions to Dr. Mfundisi, or Yes, anything you guys would like to ask, you can either unmute yourself and ask her directly, or you can post in the chat box. So we've got one question actually already. Why did you choose neurosurgery, Dr. Mfundisi?
My love for neurosurgery was mostly influenced by love for neuroanatomy and just I like things that are difficult, things that are not understood very well. And, when you say it's not very easy, I'm like, I want that one. That's the one I want to do. So I initially just loved the whole neuro anything, brain anything. At the time, I didn't really know that neuro was also including vertebra. I thought spinal cord and nerves, yes, but I didn't think that it will include the skeletal system of the, So then as an undergrad at UCT, I developed an interest in this neurosciences in general. And I was then influenced, I guess, by a male neurosurgeon who was the first black neurosurgeon to train from UCT, Dr. Kachinga Suchizia, who took on my interest and then invited me to surgery once. And he invited me to one of the most amazing surgeries that you can ever think of in neurosurgery. And that is the treatment of a brain tumor we call a meningioma. One of the tumors which has most likely the best outcome after surgery, and that you can return the person to full function and they can live a normal life expectancy. So he took me firstly we saw the patient before surgery, and then we went to theater and they removed this massive thing on their brain, and the person was fine. After they opened the skull and removed this massive thing in the brain, and she was fine, and she was better the following day and getting better day by day. And I was like, oh, this is it. That's what I'm gonna do. I want to do that thing. It looks very cool. So that's how I went for neurosurgery. I guess also some people who know me will say, temperament-wise, I'm better as a surgeon than a physician. I tend to like that kind of territory. It challenges me nicely, and I really enjoy it.
Thank you. We have another question, which is, how is navigating the medical space as a Black woman?
Not easy at all. Not easy as a Black anything to start with, and especially so if you're a Black woman. And so for some of you, I guess, sometimes our sisters in the continent, and they tend not to understand the politics of South Africa. We are a racialized country. We exist along our racial lines as well. And hence the question, I think that is coming from within that context. So the obstructions are many. They're deliberate. They're meant to discourage. They're meant to prove that you are not what you claim to be. But as soon as you figure that part out, it makes life easy. I trained in Pretoria, so I trained under Professor Semuhokong. One of the first conversations that he had with me as I landed in that unit. So for those of you who don't know, Pretoria in South Africa used to be pretty much a stronghold of the racist apartheid regime. And therefore the hospitals and the whole system was pretty much like that. So Professor Mkhokong, a Black neurosurgeon, then running that department, he was of course also going to face serious hostility. And he said to me in the very first days of my entry into the department, look, you're gonna have to develop a thick skin and just understand that all that is happening is just the last kiss of a dying horse, which is pretty much not necessarily the end of racial issues in South Africa, but at the very least, we are making significant strides. And he said, you're just gonna have to be tough and strong, and a tough skin I developed very quickly, and just learning to not second guess myself and to just continue to believe that I'm worth the space and I can definitely do it. So those are the things that made it easier. There's a lot of support that I get from people, strangers at times. And in fact, just knowing that there are more people who wish me well, than not, and focusing on those voices than the discerning voices of racism, of sexism, and, just misogyny. So I tend to also tune my ear more towards the positive and the things that will make me better.
Thank you so much. So let me just go back to the next question. So that question was from Sinikewe. So Masego is asking, how do you prevent losing yourself while going through training?
Not easy. It was not easy, but you have to keep your eye on the goal. I was raised by strong women. One of them, once we were having coffee, she made an analogy of the story of a cheetah. She says, I don't understand human beings sometimes because, you know, they can be bitten by a cheetah on a simple thing. If a cheetah is out hunting and it sees 5 springboks, so whatever, you know, its prey is, and so the springbok A, B, C, D, E, and it decides I am going for springbok C. It does not care what springbok A and B and D and E are going to do. It keeps its eye on springbok C and goes for springbok C. And because of that focus, that's how the cheetah tends to win its prey. So then she said to me, you need to develop the mentality of a cheetah and keep your eye on the prize, keep your eye on the goal. Just remember what you want at the end of the day for yourself. It is not easy with distractions that are daily, but like I said earlier, I tend to tune myself to the positive that's going to get me to where I want to go. Never lose sight of your vision and your goal and what you actually want to achieve at the end of the day.
Thank you so much. So Chris Henshaw is asking, what are the challenges you face as a female neurosurgeon?
Pretty much just the general what all female neurosurgeons face, you know, the sexism that comes with the field. It is traditionally a boys' club. Even here in South Africa, it is the same. I'm sure it is the same in many other countries. I know that there are other countries which are doing far better than us. For example, South Africa has never had a single head of department being a female neurosurgeon. And of course, you can even still count the female neurosurgeons on the 2 hands that have qualified in South Africa. So you will face the same difficulties that women in other fields are going to face. You know, the second guessing, you are less than, and all of that. But I still maintain you keep yourself focused and keep your eye on the goal. Bite sometimes when it's necessary so that there'll be less distractions, and that's what I do. I don't back down. You know, I don't let anyone bully me, and I focus on what I want to do and what I want to achieve. But at the same time, some distractions do need to be addressed and put aside so that we can continue to move on. So I don't completely silence the distractions. I sometimes attend to them, but I don't spend too much energy on them.
Thank you. Patience is asking, I've often heard that people at medical school don't have a lifestyle. How would you recommend to better manage time?
Patients in life in general, you have to learn to manage your time. Even if you're not a medic, engineers have got the same issue, accountants have got the same issue. You just have to learn early to manage your time. We all have the same hours in a day. It's up to you how you split those hours in your day to actually achieve and realize whatever goal you have. I had a life in medical school. I had a life while in postgrad medical school. I still have a life even now as a neurosurgeon. But also it's deliberate. I make it a point that I make time for myself. I make time for other things other than medicine. And that is important. Otherwise, you are going to be qualified and not aware of what is happening around you in the world. And it's a pathetic living, I guess, I would say.
Thank you. Chris Sencha again asked, I'm amazed at how you got it all, a career and a family as well. How did you do it? And how do you do it?
Being deliberate, being absolutely deliberate from the very outset. I had always, well, by the time I went into training, I had met a nice guy and I had decided I definitely am going to say yes to this one, you know. And so we went on and married, and I wanted to have children. I had always wanted to have children. And that opportunity presented itself because I've got, this nice guy that I think I can have children with. But also the person that I married. I have married a supportive and loving husband who wants to see me succeed. So the traditional roles in our family don't really exist. We tended to share most of those roles. I'll tell you, my first child, I had. So I was doing, so when you're doing neurosurgery, you write 3 exams in South Africa. So you write a primary exam, an intermediate exam, and then a final exam. So my first child, I had him 10 days after I returned from intermediate exams. And my husband had driven me there because I could not fly because I was quite advanced pregnancy. It was on the east coast of the country, so it was quite a distance from where we live in Gauteng. So that support has been everything. He does his part of the night waking up. I do my part. I tended to mostly put on the breast, feed, and then he takes over from there. So we share those roles, but I also just generally have a very supportive family. And right from, when I was growing up, it was not taboo for a woman to want to do all of these things, So that has been very great for me, and that has helped me quite a bit.
Thank you. I'm just going to vary a bit the question, but I promise we'll get to yours. So Lauren asked, how did you keep yourself motivated in the journey to neurosurgery? Are there scholarships available in South Africa for international students to specialize in neurosurgery?
Keeping myself motivated. I love neurosurgery. I wanted to succeed. I wanted to be a neurosurgeon at all costs that are reasonable. And so it was not very difficult, I enjoyed what I was doing. And because I was enjoying it so much, I could actually keep myself focused and keep myself motivated. At some point in the training, you get the reality of how intense it is, but as long as you know that that's only really maybe a fleeting period, you will eventually return to some normalcy in life. So that was what kept me going. And scholarships available in South Africa for international students to specialize in neurosurgery? Not really. The South African system is mostly funded by the state to a certain extent, and therefore the state trains neurosurgeons for the country. They do, however, have what we call supernumerary positions, which is to be funded by governments of whichever country you're originating from. And then a person can come through to train in South Africa. There are, of course, some funds which will support, but when I was last in that system, I didn't quite know many. Most of my non-South African colleagues were coming through on the salary of their government and payments from their own governments.
Thank you. So Semar is asking, do you have any advice for students, trainees early on in their career to prepare for a neurosurgical career?
Definitely. I tended, because I knew that I wanted to be a surgeon. So even when I was doing my internship, I was very deliberate around the surgical skills and building surgical skills, the small things like suturing. So those small skills that you tend to ignore, they actually set you up nicely for your career later on. So when I went into the program, I had already passed my first exam, which is the primary exam, and then I went on just to do the rest of the exams in the program.
And so just to follow up on that, so if you're already a neurosurgical trainee, how do you advise a current trainee to sort of make the best of the training that they have, the relationship with their attendings / consultants and things like that? What would you tell them?
Look, mentorship is everything, and I think that the responsibility more lies with the attending and the consultants to ensure a successful career for their trainees. But for yourself as a trainee, positioning yourself well by just being diligent and working hard and showing interest, that tends to make it easier for any potential mentors to actually be able to pick you out and also assist your career. But also don't be shy to approach your seniors and ask, the hows, how do you, if for example, you have decided that perhaps you want to focus on skull-based surgery, approach skull-based surgeons, speak to them and find out how they got there. That's how I even got into the whole training program. I didn't know enough to be able to independently prepare for a training program. But I spoke to people who have done it before, who had qualified as other specialists and even in other fields, and just getting snippets of knowledge from here and there and putting that together assisted me to get into the program. But my enthusiasm and diligence and hard work also tended to set me apart. And therefore, there were very keen people who wanted to assist me to succeed and wanted to see me succeed in the overall.
I'm going to ask the question from Patience. She said, as an aspiring neurosurgeon, what advice would you give to me as a high schooler?
Work hard and make sure that your matric or your grade 12 results position you well for a university entry into a medical program. And even if you don't maybe enter the medical program immediately, do not be despondent or do not despair. There are other pathways. You can do a BSc that is still on human sciences, and then later on join a medical program. So you have to work very hard and make sure that you've got very good results in matric, but also not just academic achievements only. Involvement in the community as well tends to set you apart, and it just actually tends to groom you and help you grow so that you actually can be a conscientious clinician when you do enter, the field. So those small volunteering programs and communities, do not take them lightly. They groom you, but they also assist in the process of applying to a medical school.
Thank you. So Geneviève was asking that she came in a bit late, so she missed your intro. She was wondering which subspecialty did you do, and if yes, why did you choose it?
We generally, the internship program is set in South Africa. So after finishing medical school and the basic degree, you then enter an internship, a 2-year internship program that is set up. There's a number of rotations that one has to do that include medical rotations and surgical rotations. So I did more major surgical rotations, the orthopedics, general surgery, and of course ONG, OBGYN. And after that, then I went into community service. But when I went into community service, because I knew I wanted to be a surgeon, I asked to be placed in a surgical discipline to just continue to work on my skill there. So I actually worked in general surgery department as a medical officer for a year. And then after that, went into the program. In the program, we tended to have rotations in other surgical specialties that are relevant to the specialty that you are in. So we did some rotation in orthopedics, ENT, general surgery, ophthalmology and plastic surgery, not ophthalmology rather, plastic surgery and urology. So the programs are designed, in different ways in different institutions. Even here in South Africa, not all institutions follow the same training program in terms of exposure to subspecialties. But within neurosurgery, the subspecialties in neurosurgery, in South Africa, we don't necessarily, unlike other countries, we don't have a you don't just become a pediatric neurosurgeon, you actually become a general neurosurgeon because we are so few, and you can of course develop a special interest. But the most institutions, after you've qualified, they then allow you to go on. They form smaller units, and they will allow you to go into that area of interest. So if you've got an interest in base of skull, they'll let you do that as a qualified specialist. And if you've got interest in pediatric neurosurgery, you do that, or spine, you do that spinal neurosurgery.
Thank you. I was wondering, because we have participants from literally all over Africa, I was wondering if you had any advice for those who might not have maybe a neurosurgery program in their country, or for those who, yes, who might have to emigrate or apply elsewhere. Any advice there?
Look, there's a number of African countries, of course, which don't have neurosurgery services currently, and we look forward to those countries at some point having those services, particularly in the sub-Sahara. There's a number of institutions and training programs. Some of them are sponsored by the World Federation of Neurosurgeons. I know that there's a program in Morocco where some of our colleagues have gone on to train there at Rabat. I know, for example, Claire Karikazi from Rwanda went into that kind of a program. Then, of course, you know, being a supernumerary registrar, we call them registrars, trainees in South Africa, there are also those opportunities in all the institutions in South Africa, pretty much. And so the training, unfortunately, will not happen in your country of origin. But also just keep an eye, you know, on the WFNS programs, because there is an intention to try and improve, you know, access to neurosurgical care in countries where there wasn't any. The WFNS is also making efforts to assist to train neurosurgeons for their countries.
And do you have any advice for current medical students who might have to move and try those type of program, for them to be noticed and like to sort of be able to apply with a strong application?
One of the things that tends to be very helpful, and something that we tend to do with my own mentees, firstly, of course, it helps to get a mentor as early as possible. Those mentors tend to be able to direct you in terms of, you know, what will be suitable for where. For example, with some of my mentees here in the country, I always would encourage them to, once, of course, having finished their medical school program, to then go in and do their primary exam and maybe intermediate exam so that they actually have a strong application. But also, while an undergrad as well, there is an option of, you know, when you are doing your research programs, you actually can do research around topics that are within your area of interest. So when you're doing your public health rotations, you know, you focus your work around neurosurgery. Of course, you're going to have clues and stuff, you know, in terms of what to research from neurosurgeons in the field, but also the value of mentorship is priceless, and you need to align yourself, you know, with people who are where you want to be. You know, that is going to guarantee you the best chance of making it in that field.
Thank you. Crescentia asks, what things should one consider when choosing a specialty?
Firstly, your interests. You know, it must be something that interests you, and that interest must be sustainable over a long period. You are not going to know everything about the intricacies of the specialty. Some things you will learn within the specialty. And there's also nothing wrong when you enter the specialty and you find that this is not for me, to actually exit and then go on for something else that might actually interest you. But in general, you must go, you know, you have to try and choose something that you like, you know, and know that you're possibly going to like it for a very long time. I went for neurosurgery, like I said to you, part of the reason was that, you know, neurosurgery for me will forever be interesting, because there'll always be something new being discovered. There'll always be something new being found about the central nervous system. It is, I always tease my colleagues in cardiothoracics, unlike the heart has got 4 chambers. It shall remain having 4 chambers until eternity. Nothing will ever change about that, you know. But the brain, we keep discovering more, the spinal cord, the spine, we keep learning more and more about those particular structures. Let's make sure that no cardiologists or cardiothoracic surgeons have access to this talk. They're not going to like me. But, you know, so you've got to make sure that someone's really you're going to find it interesting for the longest time. And I tell you, with neurosurgery, from my point of view, I am amazed every other, you know, day, month. But also I keep learning, you know, even though I am now qualified, I'm still acquiring new skills, you know. Some things I'm getting, like just getting better at some things that I have done, but other things are completely new. I only learned to do, for example, endoscopic third ventriculostomies when I was already a consultant. You know, I learned from a colleague who was a consultant, and I was also not shy to say, look, hey, I've not done this procedure before. Can you just, you know, take me through a few, and then, you know, and it's a fairly, you know, the anatomy, I understood the anatomy very well. It was just a matter of not having actually done it by myself and without any assistance. So it is important to also remain, you know, willing to learn and remain teachable, you know, throughout your career. That there are still other things that I still want to learn as a neurosurgeon that I haven't learned yet. But, you know, the basics, of course, are there. So like I was saying, that neurosurgery is basically, it's perpetually interesting. You'll always find something new and exciting that, you know, you'll be learning. And also, as we continue to grow in our careers, new things are being discovered, and we constantly have to, you know, we just have to keep learning.
Thank you. Genevieve is asking, I'm not sure to have understood well on supernumerary registrar in South Africa. Can you explain a bit more about what it is, how it worked? And I guess she might wonder about how to apply or something like that.
You apply to the institutions, you know, the different universities which offer neurosurgery training programs, and you just basically apply as a supernumerary registrar. There are positions that are available that are seemingly maybe sometimes ring-fenced for supernumerary positions, but in the overall, they are mostly you know, funded by the country that you're originating from. So you'll then also have to have an arrangement from within your own country that they actually will fund the program.
Great, thank you. Just wanted to ask you one more question for the medical students who are listening. So if they have the opportunity to go on a neurosurgery rotation, what would you say are the top 3 to 5 tips you would give them so they can shine and impress the consultants and attendings?
One, you know, you of course deliver yourself as best as you can. Show up for whatever you are assigned to, and show up on time, and work hard and be diligent about your work, and pay attention to your work, because neurosurgery requires one to be able to pay attention to the detail of their work. That's how successful neurosurgeons, you know, prosper. And also, once in the program, you know, show your curiosity and dig in things that I actually find interesting. Do not be shy to ask your questions. You might just find that your curiosity might just end up prompting a PhD in that place where you are actually attached. So do not be shy, you know, and do not second guess yourself. It's not easy. I know, as generally as young as women, we generally tend to second guess ourselves and to not believe that we are worthy of the space that we are given. Once you are within the space and you're invited onto that table, just own it and understand that you are there on merit, and because you can definitely prosper and succeed in that particular space.
Thank you. And I guess that would be one question for the trainees who are on the call today. What would you say to them in order to sort of prepare not only the end of their training, but also the next step when it comes to applying for jobs and like creating the career that they want?
For those people who are able to create their own jobs, you know, you need to consider doing that. But for those who have to then apply for jobs, it is just the same, you know, hard work and having set yourself apart. You know, you must make sure that you develop a niche for yourself and something that's going to set you apart from the candidates, that other candidates that you have to compete with. And also, you know, keep in touch with what is happening around neurosurgery. Fortunately, with social media, you know, the social media has somewhat made the world flat, and you know, there's of course right now 10,000 Zoom meetings on everything, you know, in neurosurgery, and you sign up for those things that interest you and that you find fascinating, but also learn to identify gaps of service, you know, because you know, we are not all going to be spine neurosurgeons, for example. We are not all going to be pediatric neurosurgeons, for example. There is functional neurosurgery, for example. There is rehabilitation, so there's a lot of things that need to be done. And of course, always align yourself with the needs of the people that you are actually serving and working around.
Thank you so much. I'm very conscious of your time, so we're going to wrap up soon. If the chat, no one has more questions. I just wanted to ask you something about research, because there are a lot of partnerships now between high and middle income country and lower middle income country, etc. So what would be, first of all, your advice for students and trainees who are on the continent and who wants to be involved with research to like find opportunities? Secondly, to not get like screwed up and actually, have paper, like have something to show for the hard work that they've done. And then thirdly, how do you consider research in terms of like the whole package when you're looking at candidates in neurosurgery? So in South Africa, there are exams, but I guess there might also, like, does it help a candidate and things like that? Thank you so much.
It definitely does help a candidate who's applying into a program, so much that part of what we are doing when we're mentoring youngsters is to try and assist them to formulate a research question quite early in their career. And because we have been in the field for some time, we kind of know the gaps, the research gaps, and you assist the student, the mentee, to identify those gaps. But most importantly, whatever you seek to research, make sure that it is relevant to your community. And it is going to be you're going to have meaningful impact on the community that you are within. There is, of course, right now, a lot of public health questions around neurosurgery for most of our communities. And a lot of people have focused their energies around such, topics. Hence, the collaborations, and also even the identification of the so-called LMICs. And such. There is, of course, also, a lot of the guys who are already on social media who speak out about what they actually do, and to follow them and learn from them and partner with them. And there's a number of people who are actually keen to assist youngsters who wish to be involved in this. I don't do much research myself at this point of my career. I am very much, just doing clinical work and treatment. But definitely, when you're entering a program, it sets you apart to have done your research. And I would say, even for myself, I had published this as a paper as a student. And by the time I was applying for a program, those things came in handy. And to exit the program as well, there is a prerequisite in South Africa that you actually must complete research. That is part of the master's program. You must complete a dissertation. So if you go into an interview for a program, already having an idea of the research topics that you've got interest in, those are the things that are going to set you apart from other candidates.
And just to follow up on that, how do you ensure that, if you're partnering, then your name is actually on the paper?
You have to work with decent people. You have to work with decent people. You have to collaborate with decent people. But also, you actually, unfortunately, the power dynamics of research, unfortunately, they tend to be skewed against youngsters. They tend to be skewed against LMICs. They tend to be skewed against Africans. So it's unfortunate. That's how it is. But there are other Africans who are actually participating, you unfortunately have to go for decent people. You can pick up decent people fairly easily and fairly quickly. So you don't just collaborate for the sake of collaboration, because others are actually just there to exploit the hard work of a junior. And then they will take that work and then shine and prosper with it, but at the end of the day, eventually the truth will eventually come out. So you need to actually position yourself. I guess maybe part of the reason why I even exited the system, it was partly because of that. You've got interesting topics, you propose your interesting topics. The next thing you're seeing, the topic is being supervised by someone else. Your very own idea. And I promise you, this story is true for many of us female surgeons. I had a colleague of mine who is a hernia surgeon, and I'm just chatting to her after we have resigned from the public sector. And the story is, it is as if we are reading from a book, You know, the stories are exactly parallel. They are exactly the same. You've got an idea, you put your idea forward to the department. So one of the things he then said to me, we need to speak less and just work, and only emerge when you know that your things are already tied up together, you know, but also how, you know, that's going to be so energy consuming to a certain extent. So at that point, I made a decision that, look, for me, for now, I'm exiting this for now. I'll return to it later on. Let me just focus on my clinical work and raising my children, and I'll then personally return to this later. So it is unfortunate, but those are realities. You know, the realities of all of us. You know, as any people who are you know, disenfranchised, we tend to be finding ourselves in those situations.
Thank you. So just to wrap up, what are your final words for the, the people who are participating, from patients, the high schooler, to the medical student, the trainees, final word for them? Thank you so much, Dr. Mfundisi.
You're welcome. Whatever you set your eyes on is possible. And just remember that there's a lot of people who actually wish you well. There are a lot of people who are going to be encouraging and also are going to help to open the path to make sure that you succeed. And do not be discouraged or made despondent by challenges of every day. Those challenges are not only in neurosurgery, they are everywhere in life, in general, you know. So just keep your eye on the goal and keep working hard, and you shall definitely succeed.
Thank you very much. So ladies, if you have any more questions, you can send them our way. I'll try and get Dr. Mfundisi to answer them by email. Hopefully I can just compile something. Thank you so much for participating, and we really hope you found it useful. Thank you, Dr. Mfundisi.
You're welcome. Thank you very much, Ines, for having me. And I really did enjoy it. And I hope that you guys have learned something from it.
Thanks.
Cheers.
Cheers.